Hi, welcome to Voices of Somerville. It's a program by the Office of Somerville Commissions and sponsored by the Office of Communications and the Health Department here at the City of Somerville. And our program tries to raise voices up in our community, talk about different issues that we all can collaborate with. And we bring in our experts, our allies, and our colleagues. And so I'm really proud today that I have an amazing colleague from one of our foundation agencies for Somerville. We have Meg Bossong. She's the manager of community engagement for the Boston Area Rape Crisis Center. Also, the nickname is BARCC. And so when we're referring to BARCC, you can also look that up on the website too. So thank you, Meg, for coming on.
Thank you, Sonia. Happy to be here.
This is wonderful. We wanted to talk about the work that Boston Rape Crisis Center does for our community and with our community, but then also kind of just talk a little bit about living vibrantly. And a lot of the work that we're going to be talking about is living vibrantly after a sexual assault, but also we'll touch about maybe prevention and our community opportunities that we're going to do. So
great.
Let's talk about BARCC.
Yeah, absolutely. What's actually very exciting is that we are celebrating our 40th birthday this year. So founded in 1973 in next door in Cambridge. I do know there's a little Camberville rivalry that goes on, but we're close partners with the City of Somerville and have been for 40 years. So it's really nice to be able to sort of spend this time reconnecting with different communities that have been a part of our history and vice versa. There's some things that we have always offered. So for 40 years, we've had a hotline. And that has, it's always been a telephone number. So it'll show up, I think, in several places for people to see. But 617-492-7273 has been our 24-hour hotline for 40 years. It's an interesting story, actually. Someone else in Cambridge had that phone number in 1973. And it's 617-492-RAPE is the phone number. And so the group of women who founded BARCC went over to this person's house and said, listen, we're doing this thing. Could we please have this phone number? And so it's been our phone number since March of 1973.
That's amazing.
It's incredible. It's a really incredible history. And it's always been a hotline that's been answered predominantly by volunteers, which is amazing. One of the things that has changed about it is that our language capacity has really grown over the last 40 years. So truly now we could assist someone with the help of a language line interpreter. We can really find interpretation for any language. Many of our hotline counselors are bilingual in Spanish, some in Haitian Creole, and then we can arrange interpretation in really any language that people are looking for at any hour of the day or night. So that's fantastic. Another thing that has sort of not changed, but expanded about the hotline is that we used to mostly, the vast majority of our calls were from people who identified as survivors or people who had been sexually assaulted themselves. What's changed a little bit is that we get a lot more calls now from people who are parents, partners, friends, roommates, colleagues of survivors of sexual abuse, talking about really the impact that it's had on them and the whole community. The other thing is around providers, so school guidance counselors, people who are healthcare, mental health providers, clergy, calling to say, I know that I'm working with this person professionally. I know that they've had this experience of violence in their life. Could we talk about how I could be most helpful to them? So that's one thing that's really exciting about how that's grown.
That's amazing. I think that that's a testament to the foundation work that BARCC has done in growing its service provision to people who are surviving their sexual assault experiences. It's the experiential work that the staff have grown with, and then the relationships that you've been reaching out to. So and that shows in how many more people are willing to ask for more information, ask for more help, so that they can be better support in the community, that's really a good testament.
It's really incredible, and at this point we're fielding about 4,000 calls a year, so just about 10 calls a day. And one of the other interesting things is that I think another thing that has really changed over the last 40 years is that people are willing to speak a little more about not just their own experiences of violence, but concerns about what's going on in their community. So we actually get a lot of informational questions from parents saying, you know, I'm noticing this behavior in my child, and I'm really worried that something might have happened to them. Could you tell me about what I'm seeing? Or even from, you know, college roommates saying, my friend made reference to this thing that happened, and I'm just not sure, you know, how they're thinking of it. How can I talk to them about this? So not even just as a crisis line, although certainly people do call us in the days after experiencing sexual violence, but really as an informational resource. So it's great to be able to be available to people in all the different ways that would be helpful to them.
You're connected also with the system. And so what happens when you're notified through an authority, such as the police department or the ER? So there's the hotline, but then there's your other sources.
Yeah, absolutely. So the hotline is one of our 24-hour services. The other 24-hour service is our medical accompaniment program, and that's really connected to the hospital system. So people who've been recently assaulted within the last 5 days for adults and for adolescents can go to a hospital and have a medical follow-up done and an evidence collection kit done. The evidence collection kit process doesn't require anybody to report to the police. And that kit can actually be stored anonymously for up to 6 months while people make a decision about whether they might want to move forward with the police. So when someone goes to what are called SANE sites, that means sexual assault nurse examiner sites, one of our medical advocates is paged automatically to meet with that survivor. And that can be as short an interaction as that person saying, you know what, I really don't want to talk to anybody right now. And the advocate saying, no problem, here's an information packet, we're here if you need us. To something as extensive as sitting with them through the evidence collection process, which can take a couple of hours. If they have come to the hospital with someone else, a parent, a partner, the advocate can go and sit with that parent or partner if that's what the survivor wants. And explain to that person, you know, here's the process that's going on right now. Here are some things that you could expect in the next couple of days. So it's just a service that we provide automatically at these 7 particular hospitals. The other way that we are sort of connected with the systems that survivors can interact with is through our legal advocacy program. We don't actually represent anyone in court. We provide referrals to folks who could. But we talk to people about if they were to report to the police, what would that experience be like? What are the questions that they might ask? Which police department should they go to? Because there's sometimes questions about that depending on where the assault took place. Right. There are also a lot of other legal questions that come up for people. So often there are questions that people have around immigration status. So what happens if my status is complicated? What happens if there's complicated status questions around people in my family and I choose to report to the police? How does that work? Other things can include, you know, it's not safe for me to stay in my apartment anymore. Can I break my lease? Can you help me with that? Our legal advocates will help people with all of those processes.
I think that's been, you know, tested throughout the years, and you have gained a lot of experience, and so that's where incoming families and survivors will be able to lean on, because it's based on a lot of experience, but the relationships that you are building.
Yeah, absolutely.
What about some of the advocacy, the advocacy that you're doing with the larger system in the education of the system, moving the system forward to benefit the whole community and the survivors? Yeah.
So it's interesting actually that you mentioned housing. Well, that's one of the very recent things is some advocacy around housing, and we had worked for a long time. Stephanie DeCandia, who actually just won an award for her advocacy work, but around making sure that there are protections for just that circumstance, that if people are no longer safe to stay in their apartment or in their housing because of an assault, that they can break that lease without penalty. Or lock changes is another example. So if a person who has access to the apartment has caused them violence, that the locks can be changed, and as long as a tenant, you know, provides new keys to their landlord, that they can, the landlord has to allow them to have locks changed. and that you can't discriminate against people in renting if they've been a victim of violence in the past. So really important protections for people. Where that came from is seeing really closely from the folks that we were working with that safe, stable housing is really, really connected to both helping people recover from violence and keeping them safe from it in the future. So we had lots of folks who had come to us and said, listen, the reason that I don't have safe, stable housing is because I experienced this assault. And so I haven't been able to work, which means I haven't been able to pay my rent or my mortgage, and I'm in danger of losing my housing. Or I had to leave housing, and now I'm sort of floating between these really, I'm crashing with friends, I'm sleeping in people's houses who are afraid they're gonna lose their apartment because I'm staying with them. I need help with this. So that's putting folks at risk. And also people who have experienced homelessness or have not been in safe housing, and that was sort of the cause of their assault, that was people who were looking to victimize others sort of found them in these unsafe situations. So there's this really close connection between housing advocacy. A way that we're working on that specifically right now is for youth who identify as lesbian, gay, bisexual, transgender, genderqueer, gender nonconforming. A lot of those youth experience homelessness. They're either put out of their homes by their families, they're leaving homes because of abuse situations. So that's something we've heard from a lot of clients, that teenagers have experiences of abuse in their own homes, and so they're leaving. And a real lack of safe shelter options. Either they have aged out of the DCF system, they're about to age out of that system, they're experiencing abuse within that system, or they just had no place to go to start with. So really doing a lot of advocacy around how do we keep these young people in safe, stable housing to keep them safe.
Going towards some of the youth provision, let's talk a little bit about some of the youth provision that BARCC has been doing for a long time now.
Yeah, one of the things I think we're most excited about right now is a monthly teen discussion group. So it meets the second Tuesday of every month. So November 12th is the next upcoming one, and then the second Tuesday in December it meets at 5:30. There's pizza, there's food, and what it is it's a discussion group for young people ages 14 to 19 who have themselves experienced sexual abuse or sexual violence, or they are seeing people, their friends, their siblings, people around them experiencing it. And it's a way to kind of talk with other young people about those experiences and just hear, you know what, I'm normal, I'm okay. It's not okay that this happened to me, but I'm gonna be okay.
Right.
And that's really powerful, I think, for young people to hear from each other about ways that they've found to cope with things, ways that they have found to sort of get back into a little bit of a routine in daily life. So it's not often that young people have the specific opportunity to come and talk about sexual violence in their lives. Another thing that we're really excited about is a poetry curriculum that we came up with. So using poetry, specifically slam poetry, to engage young people in talking about messages that they get about violence and sex in their lives, and how can they work to change those messages in their communities. So those are the two, I think, really exciting things going on right now.
The poetry program, is that for any youth, or is that particular to the other group?
It's actually for any youth. So we have gone and done that in youth serving organizations. We've gone and done that, not yet in school settings, but certainly that's available, and we're really excited about it.
That's amazing.
Yeah.
So what we're kind of, the topic of the show is to talk about living vibrantly after sexual assault, and utilizing the services that BARCC has, and also let's talk a little bit more about what the community can be doing.
Yeah.
You've been here for 40 years, BARCC has, and so I think both of us have been.
I have
the
a great moisturizer. Yeah.
But thinking about, like, what do we talk about, like some of the community opportunities that maybe are immediately happening, and then we can maybe talk a little bit about what's on the horizon.
Yeah, absolutely. I think one of the most exciting things is that now that there's more community conversation about sexual violence and more opportunity for communities to say, listen, when sexual violence is happening, it's not just hurting the person that is assaulted, but it's really making the whole community less safe. That way of looking at this issue gives us a lot of different access points into how we can talk about this. So one of those conversations is looking at the systems that people interact with after they've been assaulted and saying what works really well about this, what's not working well, what is causing people more pain and more stress, and how can we change that so that people are not feeling harmed again after they've been assaulted. So that's one way. I think another way is for people to look at the places that they spend time in their community and look at opportunities to create safety in those settings. So maybe that's in a school setting, maybe it's in a faith community, maybe it's in a social organization. So some of the conversations that we have are around policies. What are the policies in that organization? It's easier to think about doing that with organizations that serve children or youth, but things ranging from what are the policies around how we screen people who are going to work here? How do we model good boundaries between staff and youth, youth and youth, staff and staff, and helping organizations that you or young people in the community are involved with really be good at that. I think another project that we're working on that's so exciting right now, and maybe some viewers will be interested in it, is pairing, we have a program for early childhood educators, so people working in preschools, to understand what is developmentally expected sexual behavior in young children. We know that sexual behaviors exist across the lifespan, and anybody who's spent any time around very young children knows that there are sexual behaviors that come up with young children. So in preschool settings or daycare settings, how can the staff be responding to that behavior in a way that really creates safety for those kids and safety for the center and builds up some protective factors for those folks, builds good communication skills, builds good empathy, creates accountability for folks, because we know that those are factors that help protect people against experiencing sexual violence. And we're pairing that with a 4-session workshop for parents who are that same child care center. And that's really around how do parents have conversations both with their child but also with other adults in their child's life about what are your expectations for how other adults interact with your child. So ranging from other people in your family to their teacher, their doctor, their coach, and strangers in the neighborhood. How do you talk to other adults about how to be safe with young people? So that's a program that we're excited about and looking for opportunities for people to invite us into their community to facilitate these conversations.
And it's for the entire group. It's not for a particular group because of something has happened or because there's a particular type of kid that we have to like figure out. It's about it's for the entire community, whether there's known or unknown. Right. It's to really be creative about the dialogue and the relationships.
Exactly.
And I think that's what's essential, so that people can really be able to ask those healthy questions, find out what's important to know, and be able to like continue that dialogue around all the different chains.
Absolutely. Right. And I think you make 2 really good points. One is we know that because of how common sexual abuse is, we just know that we'll never go into a group where there's nobody who's experienced sexual violence at some point in their life. But our hope is that by having conversations, we can stop any more sexual violence from happening within that group or within that community or to the people that are involved and invested in that group of folks. So that's one piece around it. The other piece is, you know, as I said before, we're facilitating that conversation. It's conversations that I think I've heard people really eager to have. One thing I've heard a lot of people say who are adults now is, I really miss the aspect of growing up where I knew that there were other adults that cared about me, that when I was out in the neighborhood and I was doing something that I probably shouldn't have been, that another adult would kind of tell me about that, and that there would be some accountability for me and there would be accountability for other people. It lets our kids be kids. That's what lets young children be able to kind of go out and play in their neighborhood, is the idea that there's a community of adults protecting their safety. Right. So people saying, I really miss that. And another piece of, you know, the things that parents say to each other, how do I talk to you know, the family members who are a little too insistent with my child about hugging and kissing. I know that my child doesn't want to do that. How do I talk to my family members about their expectations? Or I really want my child to take advantage of going to a camp or going to a program, but I want to make sure that's a safe environment for me to have them spend time in.
And what are the questions
And what
I
are the
need to
questions
ask?
that I need?
What are the program policies?
Exactly.
What are the trainings
Exactly.
that facility
Yeah.
has routinely been participating
Yeah.
in? And you know, first is, what are the questions to ask?
Right,
The next
right.
is, well, what should the best answers
Exactly.
be? And maybe how can a parent or counselor or staff person help facilitate the creation
Of good policies.
of good policy, because
Exactly.
it is a process. I know
Exactly.
my religious center went through that, and it was a long process, and some of it, you know, were, you know, facilitated, some were not,
Yep.
and some of it was, you know, a little bit clunky.
Exactly. Exactly.
And it was, and some people, you know, experienced pain through the process of trying to figure this out.
Yeah.
And
Yeah.
and I think people shouldn't be shy about having a clunky process and having it, you know, because it's the process. But to have facilitating opportunity is really important.
Yeah.
Yeah.
Yep.
And it's based on all the experience that BARCC has had in the community. So, so continuing on this thread of vibrant living, you know, what are some other ways that our community can assure that those who are surviving sexual assault, sexual abuse, can turn towards more than just BARCC? What would you think
Sure.
are some good programs or some suggestions that our community can support?
Yeah, absolutely. In some ways, that's kind of a challenging conversation to answer, or a question to answer, because it's sometimes so individualized for people. So whereas some people feel, you know what, I am fine navigating my day-to-day life and going to work, but it's really my closest relationships that I'm struggling with, that I'm struggling to really trust people close to me in my life. Other people are saying, you know, I'm fine with the people very few people I know I can really trust, and it's hard for me to really go out and do a whole bunch of activities in my community because I don't like spending time with people that I don't know. So I think it's working a little bit individually with people to figure out what are the ways that an experience of sexual abuse, either your own or someone close to you, what are the ways that that's impacting your life on a day-to-day basis, and figuring out, you know, I think the goal is, how do people feel safe in their own body, first of all? So some ways that people are doing that, we have a yoga group. And so it's a mixture of yoga, very basic sort of yoga questions and, not questions, excuse me, but sessions. So what are some postures that can help people feel more grounded? There's a saying that sort of the body remembers things that have happened. So a lot of people have shoulder pain, they have abdominal pain, they have headaches. What are some, you know, postures or movements that they can do to sort of let the body release some of that tension and some of that stress that it's been holding? And then combine that with conversations about what's the sort of day-to-day impact. So that's sort of, you know, things that people can do very close to how they're feeling themselves. Another thing, people ask a lot actually about self-defense classes. You know, what would you recommend self-defense classes? I think that's a complicated conversation, because sometimes when we talk about physical self-defense, it can come across as blaming people for an assault that happened. And we just want to be really clear that it's never a question that somebody maybe didn't fight when they could have. It's never a question that somebody, there were things that they could do to prevent their assault and they didn't. That's not what it's about. What we've heard is that a lot of people want to have reinforcement that they're safe in their bodies. They have boundaries that other people have to respect, and it helps them sort of find a voice for themselves and practice using that voice, especially groups of people who have been told that they can't do that. So people with disabilities are often told that they don't have a voice. LGBT people are often discouraged from using their voice because it might make them unsafe. So that's a sort of groups of folks who could really use some practice saying, yeah, you have boundaries. People need to respect them. You deserve to be safe in your body and in the community. Impact is an organization in Malden, based out of Malden, but they serve Greater Boston, that does really good work with folks who've survived trauma, people with disabilities, LGBT people. They do really, really excellent trauma-informed self-defense work. Other ways are around volunteering can be really helpful, and not just volunteering with BARCC, but in communities where you can have an impact. And so maybe that's with your PTO, maybe it's with your faith community.
PTO?
So the parent-teacher organizations and communities, sorry. So sometimes that happens at a district level, sometimes it happens in individual schools where parents can come together and be a part of the social life of the school, and in some cases have influence over policy. So
these are ways to help have influence and create safe places, safe programming. So we've talked about the idea of a self-defense class and maybe kind of re-looking at that from the perspective of what's the purpose of it, and making sure that we're looking at it in a more healthy way that's supportive of an individual, and then also anybody can get involved in the parent-teacher organizations to help maybe influence some of the policy.
And part of the reason for that is that sometimes we need allies. We can go to people and say, this is a big problem in your community. Lots of people have experienced sexual abuse, and lots of people want better policies. And sometimes the response is, yeah, but you have to say that. You're the Rape Crisis Center. So it can be very helpful to have allies who are not our staff or not our volunteers saying, yeah, I really am interested in talking about this. I really do want to hear more about this. I want this to be a safe place for folks. So it doesn't even have to necessarily be connected to what we're doing. The other thing is around, we have a legislative alert that people can sign up for. So when there's legislation that's coming up that impacts systems, that affect survivors or that affect issues around sexual violence, that people can make calls to their state representative, to their mayor, and let them know that, listen, this is coming up and I really it's important to me that you pay attention to this, and I expect you to.
Right. I think the choir voice is always more powerful than an individual soloist.
Absolutely. That's a great analogy.
Right. And I think that especially if anybody has ever been in an auditorium where there's a soloist on the stage, and then they get towards that part, that American Idol part where the choir comes out and you're like, wow, that's amazing.
It's true.
And then the more exciting part is the choir that starts coming down from the back of the audience and is walking down the aisles and is from the group, and then you're surrounded by all the voices.
Exactly.
And then the best is everybody in the audience is standing up together, and everybody knows the same words, and they can all join in, and it really becomes like a tour de force, So Meg, thank you.
Thank you, Sonia.
This has been an amazing conversation to talk about living vibrantly in our community and surviving sexual assault, supporting people who are surviving, and helping to create a culture, a climate where we're trying to work to prevent this. And I think that 40 years of having the Boston Rape Crisis Center here is really critical, and we look forward to the next 40 years. And so if anybody has any questions about the Rape Crisis Center, we definitely have been showing the telephone number, and we'll show it at the end of the show. What's the website?
The website is www.barcc.org. And that's available in English, and there's also a Spanish version as well.
And then calling the hotline, it has the hotline language available too. So there's someone out there who can help answer your questions. So thank you very much, Meg.
Thank you, Sonia.